Welcome back. London Mayor Sadiq Khan said he was kept in the dark over the seriousness of Covid-19 at the beginning of the pandemic. Speaking at the inquiry today, he also said the government's Cobra team lacked knowledge about the unique risks Covid posed to the capital's 9 million residents.
I'd been kept in the dark as the elected Mayor of London, and I felt almost winded in relation to what was happening in London, but also realising there are things we could have done in relation to some of these issues. Some we did, St Patrick's Day, enhanced cleaning on the underground. Others we didn't do. And I was quite clear, not in any way to sound panic-driven, but I was alarmed by what I was being told in relation to where we were and where we may go to. And I will never forget that sort of feeling of lack of power, lack of influence, not knowing what's happening in our city.
Still with me in the studio, TalkTV's chief political commentator Peter Cardwell. Also joining us down the line, virologist Dr. Bharat Pankania. I might start with you, Doctor. Good to have you on the programme again. Thank you very much indeed. When you hear Sadiq Khan say, had he been better informed or more earlier included, he would have done things, implemented measures which might have saved lives. Does that make sense to you, or does that sound a little bit as if he's over-egging his part here?
Well, what it's clearly being articulated, and this is unfolding in the inquiry, is that there was chaos at the heart of government and it was disjointed. And by disjointed, I mean key people like Mayor of London, one mega city in the United Kingdom, were not included in the conversations. Going forward, however, the United Kingdom works in unison. So I don't know what Mayor Khan could have individually done for London without the government's approval. So therein is the issue. Mayor Khan would have liked to have done things, but was he empowered, easy empowered to do things differently for London? I don't think so.
Okay, what I'm asking you as a virologist rather than the formulator of government edict. So from a virological point of view, are there things that could have been implemented sooner that would have made a difference? After all, we did lock down, we did work from home, only key workers got on board the tube or the buses. There was enhanced cleaning of the buses. Eventually, and it did seem to take months and months and months, masks and mask wearing in public and in shops were obligatory. So what are the other things, if any, that Sadiq Khan could have done? Imagine that he was empowered to do them. What would they have been?
Well, the key thing was also early action, because early action prevents the large number of cases being generated and then a large number of people being admitted to hospitals. So early shutdown measures would have saved lives. And of course, at that point, that early point, there was ambivalence about, is this heavy droplet spread or is this aerosol spread? And now that we know, we found out earlier on that aerosol spread was key, better ventilation and protection of, for example, those bus drivers on those crowded buses where inevitably they got infected and many of them died, unfortunately.
So are you saying that we knew early enough to have implemented measures on buses early enough to have stopped bus drivers dying? Because are you talking about kind of perspex screens and that kind of thing? I had thought that we had learned that they weren't really as effective as people hoped they would be.
So I agree with you about the perspex screens. However, with respect to grasping the nettle that this is aerosol spread and stop sitting on the fence, and then address the issue of, well, how do we make this aerosol spread less infectious, which is ventilate, wear masks, wear good quality masks, wear them properly. All of those things we lagged behind in implementing.
But
We were very
Doctor,
reluctant to do.
I was broadcasting every single day at the BBC through the pandemic, and every day I asked every virologist, epidemiologist, every World Health Organization spokesperson, is it time that we, my lovely listeners, our audience, is it time we wore masks? And my goodness, there was a great reluctance to say it would make any difference. In fact, the opposite. I remember various doctors and experts saying, no, it's a terrible idea because actually people don't know how to wear them. They won't be wearing them in clinical conditions. You know, you'll be wearing a mask, you'll take it off, you'll smear the virus all over your face as you take it off. It'll then be all over your hands. The next thing you do, you're infected. They're counterproductive. They don't work. Do not bother wearing them. And then suddenly, bang, you've got to wear them. You can't go in a shop without them, etc. So it took an awfully long time. It wasn't as if it was really Boris Johnson and Chris Whitty leaving Sadiq Khan out of an agreement. They took ages to reach any sort of consensus about this stuff, didn't they?
They did. I don't disagree with you. And I was involved, and I noticed the ambivalent messaging, the reluctance to message. And you see, it's not only masks, it is reducing overcrowding. It is improving ventilation. Improving ventilation is not an easy task to do, schools and crowded places. So we know that there was a lot of reluctance to say, look, this is aerosol spread, now let's do something about it.
But I suppose what I'm asking is, even if Sadiq Khan had been invited to the meetings early on, would there have been any conclusion or result that he could have taken away with him and implemented in London that would have resulted in saving lives? Or really, was everything so like an aerosol spray itself, up in the air, that nobody really knew what exactly to advise anyway, and there was nothing that they were withholding from him deliberately because they didn't know what to say anyway?
That's true. However, you know, as the mayor of a mega city, I think he should have been included in the conversations, because London is not any old city. It is a mega city. And if Mayor Khan has got the powers to implement things, he should have been included in the conversations.
Yeah, but not just for the fun of it. You know, if they weren't really saying anything particular and there were no actual concrete conclusions, so therefore there was nothing particular for him to implement, then when he stands to the inquiry and says he needed more power, more influence, and then he would have saved lives, the question is, would he or wouldn't he? Peter, what do you make of that excluding Sadiq Khan? And people realise it's a Conservative government, Sadiq Khan a Labour mayor. I don't know whether would have been ridiculous to expect them to work in symbiotic harmony.
Well, health policy and the health secretary is meant to be for all of England. So listen, I'm sure the devolved institutions, both mayors and certainly Scotland, Wales and Northern Ireland, were brought in at various points. What happened in a lot of those meetings, there were lots of complaints about things leaking from those meetings. And of course, Sadiq Khan, even though this was a vast global pandemic, is nonetheless a political opponent of the people who were in Downing Street at that time and still are. So there would have been worries around that as well, things coming out to show the government in a bad light. So those will have been some of the considerations going around. I'd be interested to ask Sadiq Khan, what would you have done that would have saved more lives?
That's what I'm trying to say. What was the information that you could have acted on, and what would it have done?
That's the question the COVID inquiry should have asked today and didn't.
Yes, thank you very much indeed. Thank you both. Coming up after the